Hi, everyone. Welcome to this morning's session. I'm going to give us just a few seconds while attendees come in and then get us started. Right. It's lovely to see such a great turnout this morning on a Monday morning for us, afternoon for those of you in Rwanda. Good morning and afternoon, and welcome to our third session in this series on women leaders in global health, exploring non-academic careers. I'm Dr. Anna Kalbarczyk, the Assistant Director of the Johns Hopkins Center for Global Health, and one of the founders of this series, and also your moderator for today. This series was designed by a team of faculty across Johns Hopkins University to support graduate students and young professionals in exploring different career paths that leverage their education, but may not be based in an academic setting. We use a women's leadership lens that recognizes the vast experiences of women in the field. Today's session will feature a 30-minute talk by Dr. Agnes Binagwaho, followed by a moderated Q&A. Following the Q&A, all participants are invited to join our Slack workspace for a short after party where we can keep the conversation going. A few ground rules for today: please introduce yourself in the chat and connect with others who have joined with us today. We welcome you to add a link to your LinkedIn profile as well to facilitate any further networking. We'll be posting a few occasional links throughout, and you can follow these, including to our Slack channel, where we'll have today's after party, so please watch out for those. If you have a question for Dr. Binagwaho, please add it to the Q&A function and not to the chat. This will help us keep track to make sure that the most possible questions can be answered. Also, in the chat, when introducing yourself, please make sure that you select all panelists and attendees and not just all panelists. Otherwise, we're the only ones who get to see what you've written. Today, we have the pleasure to hear from Dr. Agnes Binagwaho, a Rwandan pediatrician, co-founder and vice chancellor of the University of Global Health Equity in Kigali, Rwanda. The university is an initiative that focuses on changing how healthcare is delivered around the world by training global health professionals who strive to deliver more equitable health services for all. Prior to her role with UGHE, Dr. Binagwaho served in several high-level government positions in Rwanda, including as the first executive secretary of Rwanda's National AIDS Control Commission, then permanent secretary of the Minister of Health, and 5 years as Minister of Health. Now, I won't say much more than that because Dr. Binagwaho will be sharing her leadership journey with us today. So with that, I'll turn it over to her. Thank you so much for being here today and for sharing your experiences.
Thank you very much for having me. I hope I'm not on mute.
No, we can hear you.
Okay, very good. So thank you very much to having me. And it's a great pleasure to spend time with you to explore this subject that is a very crucial one, calling on all women to build upon our strengths to reach greatness in global health leadership. And this talk to all the students, women and men, because change will occur if both of them are in the battle. Sorry, in the war. It's not a battle. Today, I will examine the gender disparities and in global health, but tackle a little bit in academic because that's where you are now. And that's the place where you have to learn how to contribute to change how the world functions now. And also we'll talk about guidance and example on how we can challenge the status quo and advocate to promote more women in leadership position without exposing necessarily yourself. We will explore the status of women in leadership with a focus on global health, provide advice on how to be a global health fighter that can promote women leaders. I will pass through the journey of Rwanda towards gender parity, and I will present my university, the University of Global Health Equity, how it's a model where we implement gender equity in academic research, but also at the field. So I like the title that it's not in academic only, because we cannot ensure women leadership in global health if we are not working hard to assure it in all the sectors. Let's have a look. In other areas, such as the political areas. There is only less than 25%, less than a quarter of women that are in leadership position. And if we go at ministerial level, less than 21% of ministers were women in January 2019. And if we now go for head of states or head of government, only 11 women out of more than 197 countries, and head of government, 12 women. And in corporate, it's almost the same. As you grow in leadership, less you have colleagues that are women. Like we have 47% of women that are in support position, 42% that are professionals, 37% that are managers, and now senior managers, less than 30, and executive 23. So this has to make us reflect on what happened. And I want to take an example for corporates in the US, because that's the place where you are based, where you can see that things has changed a very little the last 5 years. And the last 5 years, we had a lot of movement across the world. Remember, the gender respect requested with Me Too, gender equity movement with the WHO, the new elected at that time, WHO director. And you can see that it has changed very little, 4%. In 2015, it was 17, the percentage of women was 17. Today, it is 21. And in middle position, there is almost no change at all. So how come that with the expression, the way we express all ourselves about this inequity, and there's so many men that are for equity in general, global health fighters in particular, things are not moving even in our field. So because in our field, it doesn't move either. Look, gender inequity in academic leadership. Only 39% of the top 20 universities are run by women. And only 24% of the directors of Global Health Center in the top 15 US medical school are women. And there is only 40 vice chancellor. And that means if I'm not there, there is only 39 across the 1,500 universities across Africa. According to UNESCO, 31% of all positions in science, technology, and innovation only are held by women. And in 2018, in Latin America, in Mexico, only 10% of directors of scientific research institute were women. So we need to change that, because when we go deeper in research, and I don't talk about academic research only, you are global health, you will be global health leaders and fighters. And everything you will do will have to be evidence-based. And for this, you need to understand how to do research, whatever place you are, at least how to seek the data to evidence your your argument and your thought, and when you do advocacy. And you can see that only 30% of women are researchers. And they are less in private sector, where there is a higher salary because of gender bias and better opportunities for men. And even in publication, there is a systematic inequity. There is an article published in PLOS that showed that men are 2 times more likely to be invited to submit a paper than a woman. So this is the invitation. But there is a sense also that when a woman is not known, she has more difficulties than when a man is not known for the first article. So even in authorship position, they are less likely to be first author or senior author than a man. So this shows you the example, region by region, how in West Asia, there is only less than 19% of women researchers, and worldwide, the 30%. And also in Sub-Saharan Africa, the 31%. So we are just at the average. And the countries that are doing the best is Latin American and Caribbean. But even there, not 15%. And it's not normal, because it's not that we are less in those universities, is that only we have less opportunities in those universities. And look here, this slide shows you where women are lost in the system. But I took the academic system because it has been well studied, but it's the same in private sector or elsewhere. We have more female reaching the level of a bachelor degree, more female reaching the level of master's. And when we go to the highest paper, look, dramatic drop. Less women have a PhD, and less women are researchers. And this is not normal, because if you look this slide, more than 80% of global health students are women. I think you should look in your class, even if you are not in the same room, maybe. More than 80% of students in global health are women, and only less than 20 are men. But look, we have more than 75% of men in leadership position and only 25% of women. And when we go to instructor, we have half of the instructors that are women. And when we increase in leadership, you will see the number of women dropping. In the next slide, we go in service delivery now. 70% of the global health workers are women, but only 25% are in leadership position. And there is a serious segregation of women. 90% of them are nurses, and a minority are surgeons. So that means the environment of education or the trust in high position, it's not given. It's not gender friendly for women. And when you see also something, we talk a lot about the professionals, health professionals who died in this pandemic we are all facing. We talk about doctors, we talk very little about the nurses, and they are the majority who die. And why again? That's a gender bias. And if we go in my continent now, in Africa, among the global decision makers, Africa has a very little representation. That doesn't match the importance of the continent in number of people, and even in surface, and even in number of countries. There is more than 54 countries. And in those leaders, when we go to women leaders that are even less represented than in other continents. So how can we think about making a change to improve the representation of women? You can see that we need to convince. There is studies who have been done showing that some countries are losing more than $1 billion a year by not educating girls the same way as boys. And in countries, in developing countries, it is phenomenal what gain could the country have in its development if they change policies. And it's not primary education, because now you'll see in the world there is an equal entrance in primary education. And women, girls are drop out slowly by slowly, because communities, the world, families has been convinced that this is the role of women. So among the advocacy, you can see in the next slide, we need to use our voice to advocate the position of women in leadership. It's having more women in leadership that will change the situation of women in global health, in non-academic and in academic, and also in other sector. As I told you, we need in private sector, we need in government, we need at state level, more women. And women are, you can see, I have here the picture of 7 women, head of states, and it's not any coincidence. 194 countries have been analyzed deeply, and the women-led countries had a better response, a quicker response, and were more decisive to saving life and had better outcomes. And this is not by coincidence, because women expand the agenda and give more attention to issues that disproportionately affect women and children and are neglected. They are more likely to support the human development and the human protection. And they are more likely to support the vulnerable and minorities. In general, not all women. And this improves the health outcome of countries. And your voice, our voice, but to know that you need to dig in the facts and discuss, because the best among the men doesn't want to face the truth and always believe that there is a reason. Or, you know, they are always once a month sick with menstruation, or, you know, they are going to give babies and lose 3 years, etc., etc. And this should not be an obstacle. Workplace should adapt, because if those women are producing babies, it's for the society where they live. Imagine that all women says, career or babies, I think countries in less than 20 years will be in a dramatic position. And so we should fight those negative stereotypes about the capability of women or what women want to do with their professional life. There is, when women apply for research, there is also negative stereotype that block them. And the majority of people who review are convinced they don't do that purposely, but in the deep of their inconscious, they are convinced that they are doing the best for the world. So we as female global health fighters, we need to change that narrative, take ownership through action. And men students, that's the moment you should dig in the data in where we go and where you want the world to go and to be more equal, and use position and responsibility and to influence through writing, and not necessarily academic writing. Op-eds are good and well read, and reevaluate the personal bias we have ourselves against us, women, and that our colleagues have about us. And women, we need to serve as role models. And also men. I love the head of NIH who said a year and a half ago, I will never go again to talk in a panel where there were men only. And look, in global health, up to 2 years ago, you see a series of old white men. Those are the experts in global health that the world will listen to, where there are so many women who are working and working hard and make the difference. We need to fix also the linking pipeline. And this we can do if at school and ourselves, we build our leadership and managerial skills and identify organizations that can help training in managerial and in leadership and in advocacy, how to express the situation for not necessarily being have a confrontation, but also manage to make institution and the system accompany us in mentorship and empowerment. Identify men and women mentors and actively set learning objectives and goals that guide the career of each and everyone. And discuss the career plan with your supervisor and convince him. I like it is in India, in one state, where a woman is the head of the research, the biggest research institute. And she said, I give the leave to women when they want to have babies. When they come back, they are working so hard that it's like they never went. And we need to take advantage of networking event or like this one or through social media to connect, to have support. And we need to use, when we are in position, we need to use that position to change the world. We should not blame only the men. There are so many women, when they reach a powerful position, who just ignore the problem. And some of them will go up to the expressing, I fight for it, they should fight also. So we need to collectively work with other women and men with this spirit, and we are many around the world. Engage in conversation, engage in support, and also make sure, that's the next slide on equal representation in global events, make sure that women are equally represented. But you will never have an equity or parity in gender if you don't fight also for racial justice, for the right of minorities, for all types of inequities. And we should not, as professionals, enter in that fight in a way that it will destroy you. When you are a woman and you are in a gathering of men colleagues, it's easy joke to joke about women. Take it with humor, or just take that man aside and say, this is what you just did. It's not at your level because it means this. And many times they don't understand how they undermine the woman in the audience. And take it as a war. It's a long war. It's not one battle. And it will take time. And convince people. Try to not create enemies, because there are good people with bad ideas. Try to show them how their attitude or their ideas or what they have said is bad. Advocate. And many men got those ideas and attitude with the first drop of milk from their mother, because the society is like that. always focus on teaching and teaching skills. And the advocacy will be crucial. So this is the skills to learn. And I'm not going to insist in curricula because today it's not about academic. And now let's talk about Rwandan journey. You know, Rwanda is a country that 25 years ago was really destroyed by one of the biggest genocide of the last cycle. And things have changed with absolutely the contrary, meaning create an enabling environment for the promotion of women. 20 years ago, the level of education of women was so low that even if the country wanted to have women educated in leadership position, it was not easy to find them. But the system, the public system, for example, changed so that the work stopped at 3 so that everybody can go and be educated during afternoon and evening universities. And women rush in that. And when a woman and men were in competition, even if the woman was capable, but has less mark, the women were taking up to the time the institution have 30% of women. So it was a discrimination in reverse, meaning it's like what we do now at the University of Global Health Equity. Because universities in Africa, at least, graduate only 10% of women, we decided to take 70% of women in medical education and accompany them to make sure that all obstacle, family, community, having kids doesn't disturb a career. And we did so, it's not equity, but we did so to send a message to the world that more should be done for women in science and women in education. So the universal health coverage, the community health workers were absolutely designed to make sure that women were not excluded through a family approach. A man who owned the majority at that time when we created it, men were the one bringing money at home or taking the money even brought by the woman when she was selling what she had cultivated. A man cannot, nobody in a family can register in the community health insurance if the entire family is not registered. And this was to make sure that women have a health insurance, and children. Because a man could have said, this child is not mine, I don't cover the child. No, if one person in the family is not covered, nobody is covered. And this has changed everything. The preventive and curative medicine were also prioritized to favor the health of women. Like we have now 93% of our girls vaccinated against HPV. So we have all a generation that is protected against cervical cancer, one of the biggest killer cancer of women. And you can see in the next slide that we have 95% of girls at school, but there is also the job there. 53% are enrolled in secondary school. So we have a lot to do to convince girls that they can have a family life in the future, but being educated. We have increased access to contraception so that women can be part of the decision of the size of the family, an increase of financial autonomy, owning land, and making marriage and divorce more easy. So Rwanda has ensured that we had the law and policies because it doesn't have to depend on one person. it has to be embedded in institution because it's a systemic problem. You have to analyze it as a systemic problem, as a structural violence against women. Make sure that all those good ideas are in laws and policies so that when the people who fought for that are no longer there, it continues. Next slide show you that everything starts in 2003. Not everything, but embedded that in the law. If 30% of election doesn't put women in leadership position, the election are canceled. And today, we have more than 60% of women in parliament, and we have also more than 50% of women in cabinet. And it's all in all the area: education, health, infrastructure, and agriculture. I will go to the next slide because changing this in global health and in health sector at country level, I show you that it cannot go with changing the position and how the society see the role of women. And today, health sector start with community health workers. We have 4 community health workers by village, and 60% of them are women. And those positions at village level, a village is 200 houses, are really position of leadership. And with the other measure, it has really changed the role of women. I have talked about the cabinet and I have talked about the parliament. And as a result, you can see that we have a major drop in child and maternal mortality. And it is the fastest drop ever in the world. And we have seen now, not only in Rwanda, in Senegal, in Nepal, in Bangladesh, that it's empowering the woman that brings such a result. And at the University of Global Health, I talked to you, we have a center of gender equity. Every year we do a gender audit, and it's a gender and diversity audit, where we review all the document produced, when we review the practice, when we review the staffing, and try to be gender equal. And I talked to you about 70% of medical students be women, but a minimum of 50% in other disciplines. And we mobilize for finance, and we mobilize for support. So thank you. Ready for the conversation.
Thank you, Dr. Binagwaho, for your talk. And there are many questions and comments that have come in. We've really got an active group today. The first question comes from Sandra. She says, thank you for this wonderful presentation. Speaking of women's leadership, she's wondering, what are the targeted solutions for intersectional identities of young women of color who often face further barriers in working in global health?
And that's true. It's Sonia who has the question?
Sandra.
Sandra. So Sandra, it's the thing is, Sandra, we will not change that overnight. And I'm going to tell you my own experience. I had really, sometime I'm in a meeting, now no longer, because they know that they call that a bad character. You know, when you say, hey guys, I'm here. And it's so fundamental that I'm in some meetings where I'm the vice chancellor, #1 of the university, because chancellor is honorific. And we are with white men because we have, UJG is a forum of global health. We want people coming from everywhere. And the people who talk, look at the white men and talk to the white men. And it's a certain when I say, guys, talk to him as much as you want. I will take the decision and the meeting is over. So they are all like this. Oh my God, that's what we did. So Sandra, you need to find a way to be excellent, to make yourself relevant to the fight. and to not accept, because it's at every corner of the work that you will find that. And you need also to never take it personally. Of course, you use your example when it's wrong, but never take it personally. All the people I dialogue with are just good people. They are just badly trained, badly educated, and being in an environment that is gender not friendly, and who believe that because you are Black, you cannot be relevant and intelligent. They are still at the case of Uncle Tom, and all know also that all the global culture has one objective without knowing it, is to put the Black people at the bottom of the social scale. And the more you claim, the more white it is. And people have just grew up like that. When you ask little kids in US, who is the bad guy, who is the guy, you show a Black doll and a white doll, the bad is the Black. So it is even in the cartoon of kids. We have a lot of work to do, but just be a fighter and never take it personally, and take argument to be the best advocate of change.
So I'd like to follow up on that. You said earlier, as you grow in leadership, the less you have colleagues who are women. Then you just said the more you climb, the more white it is. And you talked about panels earlier, right? So not being on, people pledging not to be on a panel that's all men. How do you think we can promote panels that also represent diverse voices? So not just men and women, but also women of color.
But I think that there is a movement who try to do that. But it's difficult because when you have a name, the one who came is first the white old man. And after that, you say, no, let's search somebody else, So it is purposely. We have bright, young Black women. But like me, in my panel, I always try to have 50-50 by purpose. And I want somebody from each continent. That's the only way I can be blindly diverse. Take the people who doesn't look like you and who are as good as you. And the only way is to say the world is divided in 5 big continents. Let's take somebody from each continent. And let's take 50-50. That's the way we can promote other places.
Lucy asks, how do you engage men in a highly conservative religious environment or a patriarchal system to not only work with women, but also to advocate for them?
I think in all, you have to identify the best among them. And, Jesus Christ was a gender equal guy. Was really a man who, a man or a God, take it, who really saw the woman as is equal. Look at his life. Who was near him and what happened around the 10th century? There is a pope who probably had a big mental health problem with women, who decided that women cannot be pastor, that women are the devil, and we should not treat them. We should treat them as a danger. But in life, you can take example of great ladies who have been sent, and try to find the best men in your churches to express that if we don't promote women, we will not change positively the society. Could you help me to just bring the message that everybody should treat the girls and the boys identically and give the same chance to women? There is no good religious man who will say, no, I don't. Or if they say that, you know that there is no hope, go to the other one. Leave that one. Don't try to convince that person. It's a lost case.
Chao Long says, many of us are somewhere along the MD track. Throughout training, we are disproportionately exposed to academic career paths. What are some effective non-academic career paths or models or leadership positions where you've seen female physicians who are interested in global health pursue and hold?
So you find me now in academic. I always taught, but I have been a clinician long time. I'm a pediatrician. I have been in program management. I managed HIV/AIDS. I have been a permanent secretary. I have been a minister, but I could have been anything, anywhere. So I believe that all the places are open, especially now that the world realizes that health is not a commodity, that health mismanaged pull economy down. Never than now, opportunities are going to raise. So academic is not the only career. Academic, you have to do that only if you like it. If you like it, fight to find your space there. But if you don't like it, don't punish yourself. Go and do what you like.
Could you maybe talk a little bit about your own career path and how you entered into government, how you found those positions?
I didn't found them, they found me. Because if 20 years ago you told me that I would have been a minister, I would have laughed because I'm everything except politically correct. But I was fighting for children to get access to treatment, and also for their mother to have access to prevention of the possibility to infect their children. And because things were not done as I like, I fight it, and openly. So they start say, okay, you can do better, come and do it. I say, of course. So I got the opportunity, and the opportunity, I took it because, not because I found that was my place. And this is why I say that we women, we are biased. At that time, I'll say, oh, no, I cannot do that. You know, I argue, I say, I'm so open that I will spoil the game. And thanks God that the leadership says, no, go and do it. And I went because you cannot always be in opposition when you give the opportunity to go and change things, don't miss it. But also I realized afterwards that if I was believing that I was not the best person for the position, what I know now that it was not the case. If I believe that, it's because I'm a Black woman and I have been in a society like that. So Black women in general, and men who are feminists, just understand that my career has shown me. After that, I claim like that. I had confrontation with my superior, and they say, okay, you can do better, do it, etc. So we need to be ready, and everybody is capable of everything. That's never believe you are not capable of something. And when the opportunity is there, call friends, call your network, have support, but take it. And if you don't succeed, don't be worried. You will always do better than a misogyne. So go and do it.
I appreciate the advice too, to seize opportunities, right? You said it found you and you said yes to the opportunity. This is advice we've heard from other speakers in our series, that this is something you have to do. You have to be ready and you can't be afraid and you have to try, and that's part of being able to move forward.
Absolutely. And if you fail, it's not a drama, because you have advanced the agenda.
Lola Adeyemi asks, what are your thoughts on women hindering women or not supporting our own growth as we should? People say we are our own greatest enemies and that we can't work together.
No, that's an excuse. We are not our own greatest enemy. Don't believe that. However, as I told you, there are some women who, and it's by character, you know, it's not because you are a woman that you are a good person. Huh? It doesn't go with it's not a gender quality to help others. And of course, the most evident thing when somebody at position doesn't help others is a woman who doesn't help women. But those women doesn't help bright young people either. So we are not our best enemies. Our best enemies are people with this mentality, men or women.
Yeah,
And
I
if
think
you
that's a,
and if you believe we are our best enemies, you are still culturally spoiled.
what do you mean by that?
That's what the people told us. It's not the reality. That's what the society told us to justify the continuation. It's not the reality. The reality is a structural problem, that it's a structural violence against women. And if some women contribute to that, they are the minority. They are not the real enemy.
So you're talking about structural problems, and I think, Lola, it might have been you as well who said in the chat earlier that you were surprised that an institution like Johns Hopkins was sort of doing what we might perceive as a bare minimum for promoting equity among women, which some of us in the faculty might say we're working towards. But Dr. Agnes, I would ask you, what do you think we can be doing as members of institutions to move the needle forward at the structural level, at an organizational level?
I think what you can do, and I always believe, as it is a structural problem, change the structure. Meaning your university have bylaws. There should be gender requirement for each level. And note that if we don't do that, you will have less women in leadership position. You have more men, and men are more biased than any woman. So change the bylaw of your university in matter of gender. The other thing, do a gender audit. What are in the law against the environment of women? We cannot be penalized because we are producing more for the societies than our colleague men. We are producing baby, we grow during 9 months, and we are penalized for that. This is enslaving our body. We should be awarded to get a baby because this baby may be the next Nobel Prize, and we should be taken as mentoring a Nobel Prize when we are pregnant and breastfeeding. Change the bylaw in favor of women, and change them really in favor of women, not on sofas, meaning pregnancy, breastfeeding, child sick. And you can see when you have a woman in leadership position, how the country is well led and people are more safe.
Thank you. Okay, that's great perspective. And I think you're getting a lot of applause and yeses in the chats. Emma asks, Emma's asking if you could give any advice to young women who are interested in the relationship between health and politics and government. Do you recommend having a strong research background for people who are interested in health policy?
I'm not sure that we need a strong research background, but what we need is use the result of research. That's different. Because researcher, you need to like it, but using the result of research, this is an obligation. Everything evidence-based, and do your policy evidence-based. When I was leading the policy making in my sector, any policy I give has to be referenced like a peer review article. How do you prove that it's true? There is a document to prove the projection we had. Everything you do, reference it as a peer review article and master it. Whatever you do in policy, in private sector, everywhere. But not necessarily be a researcher, but use data and use research.
Do you have advice for people? I mean, I think this is also a large area of research, is how do you promote the use of research in health decision making and government decision making. In your experience, what is the best way to move the needle here and to push forward in promoting evidence-based decision making?
So moving the needle it's like moving the needle of gender equity. It cannot be only in health. It has to become a national culture. And it has to be a government culture. It has to be an institutional structure. And it has to be like, you know, this COVID crisis will bring a lot of reflection. So many fake solution has been published in great article, in great journals, sorry. Those people should be penalized, but we don't. We just put a little notice, don't consider this article. So the accountability of all sectors has to be also created. And we should count saying how many people did die because of this article. So creating evidence-based, start by yourself, convincing your colleague, your institution, and your network that only evidence-based can protect. Because even the evidence of today will be a joke tomorrow. We know that. Science. But if it's already a joke today and you bring that as an evidence, you should be make accountable, at least by your community, your scientific community, your network.
Earlier, you mentioned that that women should be doing more writing and sharing, and not just academic writing, but also things like op-eds and other types of opportunities for writing. But I think particularly for women who are more junior, maybe some of the women on this call and doctoral programs or junior professionals, they might not have a lot of guidance for how to do this. So how did you start jumping into writing and sharing from different avenues?
Okay, there is not having the skills to do an op-ed, just go Google, how do I do an op-ed? And you'll have a series of videos who told you how to do that. The big problem is all those journals who prefer fake news from known people than bright news from young people. So blog, go to your university, post it in your university, post in a local journal. You know, you don't know where it can bring you, because when it is somewhere there as a Google document, it can be referred anytime. So going in known journal, etc., is not necessary to be known, read. Just go and go. I used to write a lot for my local journal. And one day I wrote an article about the misuse of data by international organizations. Well, evidence. And somebody read it and send it to WHO. Before the night, it was on the web of WHO because I was attacking them elsewhere. And he tweeted. At that time, tweet was, and still now, was used for good things. He tweeted, I never know when what I read in the morning will bring me at night. So write anything, post it in your local journal, but internet also, and Google it and tweet it.
Right, so it's really about getting it out there.
Out there. And also, if you don't know how to do op-ed or article, Google. And there is a lot of YouTube by great people who tell you how to do it. And if it's not the best, you don't care. Have the idea out there. Because the norms to do an op-ed have been made by people, for people, and will change with people. And you are a person.
We have a question that I was sure would come up at some point because you talked about mentorship during your talk. So there's a question specifically, this is from Elise. What advice do you have for women of color, especially African women, who face challenges finding female mentors in their institutions or fields because of lack of representation in leadership positions?
So take a very bright woman of color in another field. because what she will take you how to navigate your field will be bright enough to help you to navigate your field, make you great and a future mentor of somebody.
Yeah, I can't agree with you more. I think it's important that we step outside of our fields, that we find mentors and network where we can to also expand our own perspectives and horizons.
And also, it's not because you are Black that you have to take a Black woman. Take a bright woman. It's better than to be Black.
Okay. Okay, I think we have time for maybe one or two more questions. Mafo asks, we're going back to policy making and about being evidence informed, but can you advise on how to balance this when you're proposing innovative policies that haven't been well studied yet?
How can I balance this? You know, you have a North Star. Don't balance your North Star. What you do in global health should be for the vulnerable. If you have a policy that is promote the vulnerable, you can rarely be wrong. Now, because your policy need money to implement, never do things to get alone. If you do for a group of vulnerable, like let's take people who are living with an handicap, do your policy with them. They know better than you what they need. And when you have this policy, go and sit with the people who have the money and finance, and take the people who advocate for themselves, living with an handicap, and discuss how to finance it. So at the end, your policy is a multi-sectorial policy. And the problem of sectors is that they are in a silo. And health is at the crusade of so multiple sectors. Never do a policy alone. Do a policy with the beneficiaries, with those who will implement it, with those who will pay for it.
I think that's fantastic advice. It's really about, and here again, we're talking about strengthening a network, but ensuring that everything you do is with other people for the benefit of the people that you're working with.
And at all steps, you share ideas with knowledgeable people. So you roll back your ideas when they are in minority. It's not a problem.
Yeah.
Just do something that advances the agenda.
Yeah.
And when you have agreed on something that is not as revolutionary as you like, implement it and start working to the next step. At the end, you will reach there.
So I think, Dr. Binagwaho, we've reached our time for our last question. So what I'd like to do is just ask if you have any final words, and if not, I'll sign off. But if so, I'll give you some space for final words.
Oh, I think that it was a pleasure to be with you. And also, all your questions show me that you are ready for the war, not the battle. But never expose yourself. That's my principle. Because there is nothing worse for the advancement of a good agenda than to put yourself out by being too much, not advocating enough and too much demanding. Because when you are out, they put somebody worse than you. So people you want to serve it's worse for them. Also, never believe you are not good enough. Anyone can do anything. And I'm the real proof of that, because I was never educated to be a minister. It works. Or any other position. You are bright. Only when you don't have all your brain functioning, you cannot do everything. But as you are, guys, you can do anything.
Kadest, can you move the slide to the next slide? Thank you, Dr. Binagwaho, for those words of wisdom. I'd like to invite all of the participants to our after party on Slack. So if you have items of conversation that you'd like to keep going, maybe some connections that you'd like to make, please join us on our Slack workspace. And I believe that Megan circulated this link earlier, so you can reach us there to keep it going. Next on the series, we have Dr. Sheila Davis, and also Dr. Lola Adeyemi, who was engaged in our chat today and asking you some questions. And she also shared her link about Mentoring Her, which is an organization that works to connect people with mentors. So please check out those links. Join us for the next on the series. Join us for our after party. Dr. Binagwaho, thank you so much for your time today. This was a wonderful experience. We really appreciate you.
Thank you very much. It was my pleasure to be with you. Bye-bye.
And bye-bye. Thank you so much. See you all on Slack and see you for the next session.